All right, so this is also somewhat of a long article. This is out of Cornell Hospitality Quarterly. So, concierge medicine applying rational economics to healthcare queuing. So, this one is pretty much, it's very applicable to my research question, and I'm just going to read a little bit of what we're looking at here. So, um, a model of retainer-based medicine, commonly called concierge medicine, whereby some patients pay a retainer for physician access, demonstrates that all patients can benefit from this arrangement. So that suggests their findings are in favor of a concierge medicine system. Um, and it says that one of the problems that this is solving is, or one of the solutions that it found is that it reduces the pressures on physicians to see as many patients as possible and allows patients for whom waiting is a concern to gain quicker access to medical care. Uh-oh. There we go. It's, okay. So, this just illustrates and highlights the fact that despite whatever we're spending on our healthcare system now, it seems that neither patients nor doctors are pleased with the state of our healthcare system. Patients feel like they're waiting these excessive amounts of time before they're able to meet with a physician, and the physicians on the opposite side of the spectrum are feeling overworked and underpaid, as well as unsatisfied with the patient care they're providing. So, one of the things that I'm happy that this article brings up is that the retainer fees for concierge medicine, which this says the subscribers are paying around $1,500 annually. So I don't know which practice this is referring to or where that number came from, but the concept is the same. So these fee paying patients are paying this $1,500 retainer annually, and the remainder of that retainer in this type of model can subsidize the cost for some of the non-concierge patients or the patients that are lower income. So this would be sort of a mixed model, which I think really supports my research question and also my thesis statement. So we'll see what this has to say about it. But this would be a model where there's fee-paying patients who may have, the income to do so, but by paying their retainers, they would subsidize the cost of some of the other patients of this practice who, maybe they don't have insurance, maybe they can't afford those concierge retainer fees, yet they would still gain some of the benefits of being able to see these physicians in a timely manner and get whatever healthcare they needed with lower out of pocket costs. Let's keep moving. This is one of the interesting statements that I found, which was that the concierge system is able to alleviate 77% of the inefficiency difference between the FIFO system and the minimum cost system. So essentially what this is looking at is three separate systems of healthcare. We use a mixed system here in the United States, but primarily and traditionally it's going to be a FIFO system, which it is described here. There we go. Which is basically first come, first serve. So patients line up at the door, hypothetically, or whatever. They line up and you're in a queue and you're served based on your order in line. So it's first come, first serve, which according to these graphs, that's going to be the highest cost per system. There's also a minimum cost system. But I think what this is really getting at is that this concierge system, or what they call, let's see if I can find it. it would essentially be like a mixed concierge system, where there you would have your higher income patients paying a retainer fee and annual fee, but that would also in turn subsidize some of the cost of the lower income patients. So it really utilizes the difference in patient population, which to its advantage. And so I think that takes one of the largest critiques of this model and turns it from a disadvantage to an advantage. And I think it has the potential to use that patient population in a way that's efficient for everybody involved or everybody that's coming to the practice. So just to wrap it up, this is a longer article. This is just one part of this is just a conclusion to one part of the article, but this is really going to say sort of what I'm getting at, which is concierge medicine takes advantage of the heterogeneity in customer waiting times and provides at a cost differentiated services to patients who are willing to pay by transferring some of the realized additional revenues to non-elite patients, so some of the lower income patients, in the form of discounts. The service provider is able to ensure that those patients are no worse off than before. So we'll stop there. I think this is going to be a good article to dive into a little bit deeper to get a more thorough understanding of what it's studying and the conclusions that it comes to. But in general, I think that this article is going to be somewhat in support of my thesis and my research question.